Raynaud syndrome.
Introduction. Raynaud's is an exaggerated vasoconstriction of the digital arteries in response to a variety of stimuli. It takes two forms: Raynaud's phenomenon or Raynaud syndrome, vasospastic disease with a known underlying cause; Raynaud's disease, vasospastic disease with no known cause, idiopathic. Etiology. Pathophysiology. Periodic digital ischemia due vasoconstriction induced by cold temperature or sympathetic stimuli including pain or emotional stress. Triphasic color change, white-blue-red progression. Digits turn white from vasospasm. An interruption of blood flow. Blue discoloration follows from cyanosis and venous stasis. Finally, digits turn red as a result of rebound hyperemia. Dysesthesias often follow color changes.
Raynaud's phenomenon. Vasospastic disease with a known underlying disease. Epidemiology. Demographics. Occasional female predominance. Age 40 years, generally older than patients with Raynaud's disease. Location. Affects the distal aspect of digits.
Associated conditions: connective tissue disease, scleroderma, 80–90% incidence of Raynaud's phenomenon, SLE, 18 to 26%, dermatomyositis, 30%, rheumatoid arthritis, 11%, Crest syndrome calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, telangiectasias, neurovascular compression, thoracic outlet syndrome. Presentation: symptoms, asymmetric findings, rapid progression, physical exam, peripheral pulses often absent, frequent trophic skin changes, including ulceration and gangrene, abnormal Allen test. Studies, labs, blood chemistry, often abnormal. Invasive studies, microangiology, often abnormal. Angiography, often abnormal. Imaging, radiographs, normal and not indicated. Raynaud's disease, vasospastic disease with no known cause, idiopathic. Epidemiology, seen in young to premenopausal women, age 40 years. Presentation: symptoms, often bilateral slow progression. Allen and Brown criteria for Raynaud's disease. 1. Intermittent attacks with discoloration of acral parts, intacs, bilateral involvement. 3. Absence of clinical arterial occlusion. Gangrene and trophic changes are rare. Symptoms present for 2 years. Predominance in women. 6. Absence of other disease to explain findings. Physical exam, peripheral pulses usually present. Trophic skin changes are uncommon. Normal Allen test. Imaging, radiographs are normal and not indicated. Treatment: non-operative. Medical management, lifestyle modifications, indications. First line of treatment modalities: smoking cessation and avoidance of cold exposure is critical. Thermal biofeedback techniques. Botulinum toxin A injections. Indications: medical management has failed. Presence of ischemia and pain. Ulcerations not a contraindication. Note this is off-label use. Shown to improve digital perfusion. Operative treatment: thoracoscopic sympathectomy. Indications: fallen out of favor due to rebound hypersympathetic response, digital sympathectomy. Indications: severe cases that fail conservative treatment, impending gangrene, periarterial sympathectomy. Most common method: removal of adventitia and sympathetic nerve fibers may extend to forearm. Sympathectomy is not indicated calcific arterial disease. Thanks for watching. Subscribe Orthopedics Trauma in YouTube.